This has really been a terrific day, and I'd like to thank all of our panelists for the engagement. And certainly, last but not least, we have kind of the final word here on how we're going to move forward. That comes to us from what's truly our visionary leader with regard to health disparity within the UPMC system. She serves as the Executive Vice President of UPMC, President and CEO of the UPMC Health Plan and the Insurance Division. UPMC Health Plan benefits 4 million members, providing health insurance coverage and health management services for employer-sponsored health insurance and government programs, including Medicaid and Medicare services. It is the largest insurance program in Western Pennsylvania. The UPMC Disparity Committee has had Diane Holder at the helm, not only as director of the health plan, but as a true visionary leader in how we promote and improve on our racial disparity outcomes. She has ensured that we engage a broad representation of UPMC leadership. She has helped us define our near-term pillars in family medicine, cardiology, maternal health, obstetrics, and behavioral health. She has guided us in establishing the priorities. She has inspired us to expand our approach, tackling racial disparities and inequities in close collaboration with our communities who are most impacted. Prior to joining UPMC, Diane was a founding CEO of UPMC's Community Care Behavioral Health Organization, which today is the largest not-for-profit behavioral health management program in the country. Diane has numerous senior executive positions. She serves as on the board of directors of several local organizations and currently serves as a trustee at the University of Pittsburgh. She is chair of the board and director of the Heinz History Center and director of the Evolent Health, a public company spun off from UPMC a few years back. While she began her career in mental health after training at the University of Michigan, Diane Holder is truly one of the individuals that has helped shape the agenda and the development of health disparities for UPMC. I would like to invite Diane Holder to the podium and our panelists, Susan Beta, Donder Jones, and Conrad Smith, please.
Well, thank you for that lovely introduction, and thank you really for your amazing, I believe, vision, and also your courage to bring together what I think has been an amazing afternoon. I am excited to be part of the wrap-up session today, but I'm really also very excited to be able to introduce to you one of our guest speakers. I think it's appropriate, given that this is advocacy session, that we hear from Senator Bob Casey, who I am proud to call my senator. And given his incredible track record for advocating for people for decades, he has been really quite amazing in terms of his commitment to helping the underserved. He is one of the senators I think we can always depend upon to understand the issues. He has followed in his father's legacy to really be the champion for the Children's Health Insurance Program, which helps so many children across the country. And I'm proud to say that UPMC Health Plan is the largest children's health insurance plan in the state. And we're very pleased to be able to not only help our population and the people of our Commonwealth, but we're very, very proud to be able to say that we have a senator who really cares. So without further ado, I would like to ask Senator Casey if he could share with us some of his thoughts.
Okay, well, thanks very much. I'm grateful to have this opportunity to be with you at this summit. And I, of course, wish we were in person, but these are the limitations we have right now. So we're grateful for this opportunity. First of all, I want to thank Dr. Sadowski, as well as the Executive Director of Magee-Womens Research Institute, Dr. Robert Edwards of UPMC Magee-Womens Hospital, for organizing the summit to raise awareness about women's health as well as the importance of health equity. Certainly I, as a member of the United States Senate representing Pennsylvania, hear an awful lot on a regular basis about challenges that women face getting the care and services that they need. One of the most critical areas I hear about over and over again is about maternal health, and that's maternal health before, during, and following a pregnancy. As many of you might know, and this is a terrible statistic to recite, but I'm duty-bound to say it, it's that the United States has the highest rate of maternal mortality among countries with similar economies, with 17.4 deaths per 100,000 live births. That is a terrible number that we should all be ashamed of, and that means those of us in government and well beyond government. We have to get that number down. It's a terrible indictment of our country and our health system. Almost 50,000 women each year experience severe maternal morbidity or severe complications after they leave the hospital. We know that Black mothers are 1.7 times more likely than white mothers to experience these complications. Again, that is a searing indictment of our country, and one that we should motivate us to make the changes that all of you are advocating on behalf of. So anyone who is not motivated by those numbers probably is in the wrong business. We all know the Medicaid program is a critical provider of healthcare services in the United States, responsible for half of all the births in the United States of America. It confounds me and enrages me that we have politicians in Washington who on a regular basis vote over and over and over again for cuts to Medicaid. There have been budgets just in the last 4 or 5 years that would cut Medicaid by $500 billion, by $750 billion, and one particular budget in 2018, the proposal was to cut Medicaid itself by $1 trillion over the course of 10 years. That is bad public policy. We should stop cuts like that with everything we have. And you can't really call yourself a pro-family politician if you're willing to cut Medicaid by hundreds of billions of dollars over the course of 10 years, which means you would cut it by tens of billions over the course of just 1 year. I'll let you figure out the politics of who's trying to do that. But Medicaid is critical to healthcare in our country. I think Medicaid is a reflection of our values, or at least it should be, the values that we claim to hold dear as a country. Medicaid tells us who we are. It tells us whom we value, whom we're willing to fight for, and whom we will prioritize, whether it's low-income families or children or moms or so many others, people with disabilities and seniors. So Medicaid is a critical program, but strict eligibility requirements and an insufficient number and type of providers and long wait times for appointments can prohibit women from receiving the services that they need and deserve when it comes to Medicaid. We know that some states are constraining their Medicaid programs for pregnant women to just 60 days of eligibility following the birth of a child, just 60 days. These women lose Medicaid coverage after that period. That makes no sense, but sometimes the bad public policy isn't just in Washington, it's at the state level as well in states across the country. We know that the rescue plan that we passed in March, which by the way was only passed by Democratic votes, not a single Republican voted for the rescue plan. That plan provided states with the option to extend the Medicaid postpartum coverage from 60 days to 12 months. So from 2 months to 12 months. That is a giant step forward. I wish we had more people in the other party voting for it. But I'm glad that Pennsylvania has chosen to adopt this coverage, but it doesn't address the long-term challenges that we've outlined here today. So I've introduced legislation. This is Senate Bill 1977, Senate Bill 1977, the Improving Coverage and Care for Mothers Act. This would expand Medicaid so that anyone who's pregnant or 12 months postpartum will automatically be eligible for the program. This would be mandatory, not optional. It would also add midwives, doulas, and lactation consultants as Medicaid providers. These providers offer critical services and can help address physical health and mental health for pregnant and postpartum women. It would provide states with the funding needed to implement these changes, and Democrats in Congress are trying to, right now, advance this legislation through the bill we're working on right now, the Build Back Better Act, to make progress on this issue. It would make 12-month postpartum coverage both mandatory and permanent. So you don't have that problem with states being able to short circuit the coverage, and ultimately we want to make sure that these are permanent programs, permanent policy, so they can't be undone by some politicians in the future. We want to make sure that all states that provide Medicaid coverage to new mothers do so for a full year. This effort would also provide funding for grants to establish or expand programs to grow and diversify the doula workforce. So we know that the Build Back Better legislation is critical on so many fronts, whether it's quality affordable child care, pre-kindergarten education, climate change mitigation, as well as home and community-based services for seniors and people with disabilities. But we got to make sure that this legislation also will help us build programs to address maternal mental health and other workforce challenges. So we've got to get this done. There are about 100 different reasons to pass the Build Back Better Act. And this isn't a hope to do or try to do or want to do. This is an imperative. We're going to get this done. Whatever we have to do, we're going to get Build Back Better passed. But a good motivating factor here is to make progress on behalf of women, and progress in particular on behalf of pregnant women and their families. So thanks for giving me the chance to interject some comments here today. I'm grateful for the summit and grateful for the work you're all doing. Thank you.
Thank you, Senator Casey. Thank you very much. We're very, very appreciative of all the hard work, and good luck with that bill. Thank you. Now that we've had the perspective from the Capitol in Washington, I'm very pleased to be able to introduce our next speaker, who's been really a critical leader in our region. Representative Ed Gainey, before he became the mayor-elect of Pittsburgh, has been in the State House of Representatives for about 7 years. And before that, he served in community development for the city, where he really did innovate in many ways related to equity-focused initiatives, such as business seminars to connect the minority community to capital and diversity, education, and other kinds of important programs. So as he is now moving into a new role very shortly, he's hoping to bring many of those important values and initiatives to a broader community. His campaign, which was very successful, was centered around a pledge to offer a safe, healthy, and affordable Pittsburgh for everyone. And that is a commitment that we are very excited to join with him around. And so please welcome virtually Mayor-elect Ed Gainey. Thank you.
Good evening, everybody. Can you hear me? I just want to make sure that I'm being heard.
We can hear you.
Thank you so much. Apologize for being a little bit late. We're having some technical difficulties on the desktop, but I'm honored to be here. I think this is one of the most important initiatives that this city can take on. I always say that at the end of the day, public health will create an environment in which everybody has an opportunity to thrive, and it's very important. When we talk about, infant mortality, all the way up to how we deal with how we eradicate any level of violence, from poverty to housing, to equity, to drug and alcohol, to gun violence. We need a public health plan that discusses how we eradicate violence and create peace in our streets. And it has to start from when our children are young. And that's why I've been an advocate for a public health plan for the city of Pittsburgh. Because at the end of the day, a healthier community creates a healthier city. A healthier city means investment for all. We remove the disparities that we have right now between black and white communities. We remove the stigmas that we have that when we talk about the air or when we talk about the water, that everything is running good and that everything is on the same page to be able to talk about how we have safe, clean water. We have a great opportunity now. But I know that starts with public health. We've always invested in public safety, and I'm not saying that public safety is not important. But what I am saying is that if we're going to change the city, if we're going to change how people perceive us, and that the fact that we're not in the middle of the power, at the bottom of the power, starts with public health. And we need to invest in public health, not just from an investment of funding, but also investment of resources. How we collaborate more, how we collectively come together to be able to build a healthy city. That's what makes us great. The more healthy our city is, the more welcoming it is. And so that's why you heard me talk so much about a public health plan. And as I promised on the private, I'll promise public. Magee, you have a friend in me. Whatever I can do to help when we talk about infant mortality, when we talk about our children growing up, we talk about our communities being more healthy, I'm there. I want that. And I will continue to advocate for a public health plan so that everybody in the city of Pittsburgh feel like we're removing disparities and our city is more healthy to make it a more welcoming city.
Thank you. Well, so I think that the time has come for us to be able to turn to our wrap-up panel, and let me introduce them. Susan Beta, our Director of UPMC Center for Engagement and Inclusion, Dr. Bob Edwards, you've heard from over the course of the day, Dondra Jones, who is our Chief Nursing Officer at Magee and our VP of Patient Experience, and I've had the pleasure of working with these folks for a long time, and Dr. Conrad Smith, who's really been leading the way in so many ways in the cardiology department, but really trying to translate and transfer so much of what we're doing at UPMC into the community. So I am very, very pleased to be able to be here to speak with you. I have found today to be remarkable. UPMC has a long and rich history, but like every other organization, I think, in the nation, you can't really solve problems that you don't recognize, and you can't really solve problems without your ability to acknowledge where you have shortfall. And so one of the things I think that's been important as we've really been looking together as a group, looking at health equity and where disparities occur and how we can make an impact, it's been very important that we've tried to have what I think is a fairly courageous conversation, and to say, where are we doing well, and where are we failing? And I think that the collective voice of the community, the collective voice of the leadership across UPMC, the collective voice of our incredible nurses and doctors and other people who take care of patients every day, the people who work with our health plan, who really reach out and try to improve the lives of the people we serve. I think all of these components have to come together. And I think that the voice that you've heard throughout this, whether it's our friends in Seattle, whether it's our leadership in the Hill, the themes that they're echoing are all the same. They're about understanding the history, they're understanding trauma, trying to figure out how do you build trust between communities and organizations that are there to serve them. How do you recognize resiliency? How do you recognize the kinds of incredible community strength we have while you're at the same time recognizing where there are issues and problems? And I do think that I don't know that I've ever felt as encouraged as I feel today, quite honestly, because I have heard a level of candor, people who really seem to share a value system, people who recognize that nobody does this by themselves. There is no savior here. It's really the combination of people's strengths and abilities that have to come together. And so I am very pleased to be a part of what we're doing and trying, but I think that there is so much to come, and I really would love that crystal ball to look 5 years out and ask the question that was asked by Father Abernathy, to say, will this be a day that we'll remember to say this was a juncture, this was a point in time that made a difference, and we look back, or will 5 years from now we say, well, that was nice, but we just really didn't kind of make it. I'm very encouraged. I think there's a tremendous opportunity. And so let me ask now our panel, because these are some of the folks I think that have been thinking about this a long time and have a tremendous, I think, insight into some of the things we might be able to do differently. So let me start with Susan. So, you have been leading so much of the work in the community and doing so many good things over the years. But we are, as Leslie said earlier in the day, UPMC is an organization of 92,000 employees. We're spread all over the place. UPMC has made a very strong statement, I think, that it's looking to really try to engage in a different way. But how do you get that through the whole organization? How do you do it from top down, bottom up? What do you do?
Thank you, Diane, for that question. I hope everyone can hear me okay. I, first of all, want to just say what an honor and privilege it is to be amongst a distinguished panel of speakers here, and I'm happy to answer that question. It's, we have a very robust and aggressive diversity and inclusion agenda at UPMC. I'm part of what's called the Center for Engagement and Inclusion, and it's the department that oversees diversity and inclusion strategy and implementation for the entire system at UPMC. As you know, we have 92,000 employees and 40 plus hospitals. With that said, we have an infrastructure, an organizational infrastructure in place to ensure, and we talked a lot about how we need to put action into words. Well, we have an infrastructure in place to be able to execute upon our strategies and our goals, and we also have the ability to work closely with all of our divisions within UPMC and hold them accountable to those goals. Let me quickly talk a little bit about this infrastructure. So starting at the very highest levels, we have an inclusion and diversity committee of the board of directors. And I'm very happy to say and share that this year marks 25 years since the beginning of that committee. So we've been doing this work for over 25 years. The Center for Engagement and Inclusion is another layer of infrastructure. And I said before, this is the department that develops strategy and implements it across the system as it's grown. And this department was established in 2001, so we're 20 years old. We've been doing this work for 20 years, long before the Pittsburgh Inequality Report came out, long before George Floyd, and so I'm really proud to be part of this organization that takes this work so seriously and partners with leaders across the organization to make this happen. We have over 12, another layer of infrastructure coming down the ladder. We have over 12 employee resource groups for employees who represent different persons of color, ability, veteran status, and those employee resource groups continue to grow. We just launched a new employee resource group that is staff level employees of color within the corporate services division. Very excited about this next generation of employees and what they'll share and bring to the table. We also have diversity and inclusion councils and task forces across our hospital systems. Many emerged after the tragedies that we saw in 2020, racial injustices that we saw. And we also have another layer of infrastructure, which are employee experience committees that ensure we are fostering and reinforcing the culture of our organization. And diversity and inclusion is embedded in the culture of our organization. One of our core values is dignity and respect. And so that is part of the employee experience. And then last but not least, we talked a lot about community and our partnerships, which we value so deeply, and we do, especially in the work that we do in diversity and inclusion. There is nothing that we do without partnering with and consulting with our community organizations. We have what's called a Community Health Partnership Council that includes community members, 1,000 plus strong organizations that are part of this council that we turn to and use as part of our infrastructure when we're trying to understand in real time what are the priorities and what are the most pressing issues in the community so that we can address them together in real time. And we also include, as part of that council, key stakeholders within UPMC, like the health plan, our department, patient experience, community outreach departments across our system, to really vet new ideas and strategies with community leaders serving diverse populations. So I'm really happy to share all of this great infrastructure work, and I'm very happy to say that just a couple of examples I want to share in terms of how, from a community standpoint, the council has really served us particularly well during the pandemic. I can't tell you, our partnership with the Urban League and the New Pittsburgh Courier, as soon as we shut down in 2020 when the pandemic started in March, we were able to quickly implement a 2-page spread, Take Charge of Your Health, within the New Pittsburgh Courier to disseminate educational and safety information to our communities. And we also partnered with Father Paul Abernathy immediately on the Community Vaccine Collaborative to disseminate information to community members who maybe didn't have access to technology or information. So those are just a few examples, and we are just, I could stand here all day and share you all the things that we do. But
many good things.
Yes,
many.
We put our words into action, and we hold ourselves accountable to specific, measurable goals. So.
Yeah. Well, you know, it's encouraging to know that there are all these different pieces being built and have been built. I think part of the question becomes how does the rubber meet the road, right? And that's why I'm now going to go to our champion who's been looking at Magee-Womens Hospital for years and trying to figure out what we can do better. Because as somebody who gave birth to her 3rd child at Magee, I know how important the nurses were. And I guess what I'd like to hear from you a little bit is, you know, if you look at some of the key problems that you see, you know, what are the things you think we could do better? And how are you working from your role to really increase the likelihood that there will be health equity when somebody is served at UPMC Magee?
So you talk Dondra?
Yeah, I'm sorry, Dondra.
I know, since we're both Magee.
I have another one for you, Bob.
So, well, thank you, Diane. So, you know, I get the awesome opportunity to lead the largest group of health professionals, which are our nurses. And so, as I shared in the beginning, my reason for coming to Magee was truly to be able to make a difference. And I got there in May, and I think I've been on the job running, right? And really educating our nursing team about disparities and what's happening. Many of them don't know about the inequities report in 2019. We just had our perinatal and newborn conference 2 weeks ago. That was first on my agenda. I am there to really educate and showcase what is happening, as well as then to develop the strategies that we can do to improve and do better. And hold our team accountable. So when there's something that happens that should not have happened, we're going to talk about it, we're going to figure it out, we're going to root cause and make sure that we put strategies in place so it doesn't happen again. We are keeping our data and metrics and continuing to measure our success. If we don't continue measuring it, we won't know if we reach those outcomes. We also, though, through our UPMC experience, knows that it takes individualized plans of care with individuals, and that's what we're working on. Not treating each individual the same, but treating each individual the way they want to be treated, as well as their history and what their wishes are, and making sure that we follow that. It's no longer that you can continue doing the standard practice, because that hasn't been effective for this long period of time. So our team was making individualized plans of care for each and every patient that we serve at UPMC Magee. But then it's also about our workforce. I can tell you, my nursing workforce, many of the times I don't see a nurse that looks like me in certain places. So we are doing conscious, purposeful efforts to make sure that we increase the diversity of the nursing workforce, partnering with my professional organization, Pittsburgh Black Nurses in Action, where we launched our Future Nurses Academy, which is a mentorship program for diverse nursing students, across the greater Pittsburgh area. Collaborating with UPMC Scholars Program, which we're very excited about, where we have a partnership with the University of Pittsburgh. We had our first UPMC scholars that graduated this past summer. And you know, many a times people want to say that a diverse individual may need tutoring or educational support. I'm here to tell you that our UPMC scholar, who is an African-American nurse, she finished University of Pittsburgh early and has been successful and is working at a UPMC hospital. We have 2 other graduates, and Dr. Edwards doesn't even know this, that we have secured at UPMC Magee. So we are really working diligently to make sure that we have a diverse nursing workforce that reflects the patients that we serve. We are holding our teams accountable for the care that they deliver. We are individualizing that care to make sure that we can reach outcomes.
So that is just terrific, and we're really delighted that you're there in the leadership role. Could you say just a little bit about how you think Magee could connect differently with the community?
Yes.
Because I think Dr. Edwards said earlier in the day that, you know, we can't just sit here and wait for people to come to us.
Agree.
We have to find out what they need in their local community.
Definitely. So prior to coming to Magee in May, previously I was at UPMC McKeesport, and I think we've learned this a whole lot about really going out to the community and asking the community and being partners there, where we went out to the churches with Dr. Conti and created a faith-based organization group that actually helped us to say what we needed to be doing out in the community. The other thing we're doing with our nursing team is that we know that commitment to the community is a nursing function, and it's part of nursing excellence, and our magnet designation says you should be having a commitment to the community. So then the projects that our nurses do, we have to support them being able to go out into the community. We still need to pay them. We need to support them in making sure that they are doing care and providing education and support out of the brick and mortars of the hospital, but within and embedding in the community. And I have to tell you, the panel that I was on, they also taught me that it has to be sustained. So it needs to be part of our policy and what we do every day so it doesn't end.
Thank you. Dr. Smith, you have been really a leader for us in developing many, many programs, but really reaching out into the community. But I think you've also said that you think how you scale the programs is really important, because we all know that you can do almost anything in a pilot. What actually allows us to scale so we can have true impact?
Yeah, great. It's a great question. And I think that the challenges are identifying those programs that are successful, and using that success not only to go back into the community to show that this partnership actually works in the way that it's formulated, but also to go to the other end, the administration side, to show them. And because with that, you can develop the resources to extrapolate that, to take it to other communities, to take it to other aspects within the community. And I think we've had such a gift of having leadership that understands the needs and has been supportive. And you heard the level of infrastructure and the groups that we have with the Center for Equity and Inclusion that have enabled us to sort of tap into those things. So I think it really depends on us focusing on the successes that we have, sharing those back with the folks that on both sides, so that they recognize the partnership is a viable one, and that with that support we can move to other areas and expand and grow those programs.
Thank you. You're a great model for this for us, so we'll look at you for that extra help. Dr. Edwards, you run a very large academic infrastructure. You know, one of the true, blessings of our nation is really our academic centers. And hopefully one of the things that we do in an academic medical center is we try to figure out what's the best practice, and then it's our privilege to train the next generation to help deliver on those better ways. Could you say a little bit about what you think we should be doing in the academic environment in terms of research, training, to help facilitate health equity?
Thank you for that question. I really think the mission of the Academic Medical Center, if you look across the country, this is a pattern that I called out within Magee. It's replicated at Johns Hopkins in Baltimore, it's replicated in Boston, it's replicated in San Francisco General, where not 2 miles from one of the best obstetric programs in the country, you have terrible health outcomes. So I think we need to do a better job of training our providers, kind of going back to the old Morris Turner and Robert Kistner approach, to partner with the community. That requires trust, accountability for results, and a true partnership. So we've begun to explore that following the model of Dr. Conti and Dr. Smith by looking at how we can begin to have hybrid appointments with faculty, particularly in general obstetrics, but also in gynecology, that we share with the community, that work in community health centers, but also work at Magee. They're almost like the same concept we're doing with the doula program, but do it with the physician program. So they have one foot in each camp. I think that is where we're gonna make the future. And when you talk about research, there's a great deal of research to be done that's community participatory research, where we engage the community as stakeholders and partners, as Father Abernathy said, to do research together. We don't really understand exactly why we have the outcomes we have. We know that some of it's economic, and I was very pleased to hear Senator Casey's comment about 1 year of postpartum coverage being the law of the land going forward. I think that's fantastic. And Ed Gainey talking about the importance of public health in the city of Pittsburgh. We need those kind of commitments, but we also need the commitment of the Academic Medical Center to engage the community in a meaningful way and just not say, we're here, come on down and see us. We have to get out there, get our hands dirty, roll up our sleeves, and get in the community and show that we're reliable long-term partners.
Yeah, that's fabulous. Well, I too was excited by Senator Casey's comments and his, we're one of the largest Medicaid plans also, and we're the largest in Western Pennsylvania. And I think 15 years ago, we were one of 2 insurance companies paying for doulas in the country. And now, 15 years later, we're hearing it might get into the Medicaid bill and become a requirement. And of course, doulas aren't the be-all and the end-all, but they're certainly part of a team that can be valuable and helpful. Maybe I could ask each of you to respond to one more question, and maybe just give us your 60-second answer to this. What would you do to increase trust?
Oh, yeah. I think we heard it earlier. You know, going to the community, listening to what they have to say, hearing them, but demonstrating with our actions that we have heard them. We understand that we do want to partner with them. I think that was very well put earlier and speaks volumes.
Is that why our mothers said you have one mouth and two ears? Susan?
I've learned from experience exactly those things, and I also think it's important to be very transparent with our community leaders and really be honest about expectations as well. We have been very generous. We've given $147 million to community organizations from a charitable giving standpoint, and I think there's opportunity to do more, not only in terms of funding, but in terms of collaboration and deepening the partnerships and looking at potential resources in a different way. But I think those are really key, is transparency and really open dialogues to foster that trust.
Great. Dondra?
I would say it's definitely about listening, and then listening to what's important to that individual or that community. Sometimes we listen and we still want to do our own agenda. So it has to be what we need to be making sure these are shared goals, but you have to listen to that individual in that community to be able to reach that and to build that trust.
Thank you.
Quite simply, consistency and sustainability. What I hear, I partner with Dan Swayze, James Taylor, and James Schuster, and we reach out to the community. And what we hear is, you come and you go, you come and you go. And we need to figure out a way to do this where it's not dependent on a foundation grant or some other initiative that disappears and then we pull the program back as soon as we get into some financial hardship. We need sustainability. We need to show that we're a consistent partner for our community betterment.
Well, I'd like to thank this panel for your comments and your wisdom and for all the great work you do. And I would like to thank the audience and everybody who tuned in virtually for participating today, and we hope the next couple of days are equally great for you. Thank you.